want to thank everybody for being here today. I want to be sensitive to everybody's time. I know some of our panelists are on a time schedule today, so I do want to go ahead and get started. My name is Carrie Knuth. I'm the Interim Director of Student Life here at the Ivy Tech Fort Wayne campus. Today we have partnered with our Diversity Council for the Ivy Tech Fort Wayne and Warsaw campus to bring you this discussion, panel discussion on vaccines, a very in-depth conversation about vaccines and their relation to cultures as well as politics. So I'm going to turn it over to our moderator, Ashley Henderson. Ashley, I will turn it over to you. Thanks for being here.
All right, thank you, Carrie. My name is Ashley Henderson, and I'm an Ivy Tech Fort Wayne staff member and a member of the Fort Wayne Warsaw Diversity Council. So on behalf of the Fort Wayne Warsaw Diversity Council, I want to thank each of you for joining us today. Ivy Tech Community College is dedicated to establishing a sustainable culture where everyone is respected, accepted, and valued, with a commitment to civility in which we can encourage professional and academic development with open communication, honesty, empathy, and respect. The Diversity Council seeks to create a platform to begin dialogue on topics that could sometimes lead to uncomfortable but necessary conversations that can express differing and controversial viewpoints. As an institution of higher learning, we know the importance of having discussions where people can safely touch on social issues and current events. Today's discussion on the topic of vaccinations and the current pandemic can be difficult, and we ask that you listen to learn and listen without judgment. To keep our presentations moving, we ask audience members to mute yourselves. However, we do encourage you to submit questions. We will do our best to have those questions addressed either during the presentation or at the conclusion. Remember, this is an opportunity to create a dialogue, ask questions, and learn. Our Diversity Council will continue discussions and programs in a safe and open learning environment for all. While Ivy Tech Community College of Indiana continues to advocate for COVID vaccinations in accordance with CDC recommendations, we do understand and we do believe that the choice on whether or not to get vaccinated is a personal choice, and we respect that. This presentation is not intended to shame anyone for their individual choices for or against receiving vaccinations of any kind, and we will serve as a platform to provide professional, relevant, and scientific information on this topic. So thank you for joining on this very sensitive, but really critical, important topic. So today we have 5 panelists with us. I will introduce each one, and they're going to introduce themselves as well. So our first panelist today is Dr. Matthew Sutter, Health Commissioner for the Allen County Department of Health.
Hi, everybody. I'm Matt Sutter. So I'm an emergency doctor by training, been doing that for a little over 20 years. We became health commissioner by accident last year. And so here we are. We're now, well into this pandemic. I joined in June of 2020, so kind of right in the midst of the pandemic. And so I've been told that there are other elements of public health that are important, but so far I kind of know a fair amount about COVID and not a lot about everything else. So do the best I can. I'm a bit of a science geek, so I kind of like reading the studies and reading stuff, and I enjoy talking to people, so appreciate you taking the time.
Thank you very much. Our next panelist is an Ivy Tech alumni, but Candy Lazaro Palma, registered nurse for Lutheran Hospital.
Hi, everyone. My name is Candy Lazaro Palma. I am a registered nurse at Lutheran Hospital, have been for 5 years, and currently a nurse practitioner student. I used to work for the health department, and then I stayed on part-time to help with vaccination efforts.
Awesome. Thank you for joining us. We also have Sharon Tubbs, Director of Health Visions.
Good afternoon, everyone. I am, as you said, Sharon Tubbs, the Director of Health Visions Midwest of Fort Wayne. We are an agency that oversees the Allen County Health Equity Coalition. In fact, we just had a meeting less than an hour ago. And we also, when the pandemic began, or when the vaccinations became available, we assembled the Vaccine Messaging Task Force, which is a group of organizations locally that have been working very hard to raise awareness and access of the vaccine. So we lead those groups aside from our regular duties, which is to educate people and help people and empower them to live healthier lives through health education.
Thank you, Sharon. Demarcus Sneed is the Office of Minority Health.
Hello, everybody. My name is Demarcus Sneed. I'm the program manager for the Office of Minority Health. I assist our office with various initiatives that we're doing around the state, whether that be health fairs, some of our grant programs, and over our intern program and things like that. But we've been doing some different things COVID related. We've been helping communities and partners get connected with our vaccine clinics that we've been doing around the state, language assistance services and things like that. So I've been here since May. So I've got a little bit of experience with kind of some of the things that have been going on with the health department with that.
Thank you, Demarcus. Lastly, we have Sheila Curry-Campbell. Sheila will be joining us in just one moment. Oh, she's here right now. Hi, Sheila. Perfect timing. Awesome. I'm going to let you introduce yourself then.
Oh, Sheila Curry-Campbell, your first District County Councilwoman. I'm just happy to be here. Like I said, we're doing some fun stuff with kids today, so that's why I'm dressed inappropriately. But thank you for the invite.
So thank you for joining us. All right. So we have some questions that we had planned already to ask. And as we go through this, participants, viewers, feel free to put any comments or questions in the chat if you would like those to be addressed. I'm going to start us off first with sharing some data points that we had pulled up a week ago on October 22nd. And that was from the CDC. Indiana had a 49% fully vaccinated rate and was ranked 39th in among the other 50 states per population of people getting vaccinated. So I'm curious from our panelists, in your profession, what do you hear as the reasons for people not wanting to get vaccinated?
There were a few things that, when I saw that question that we've been hearing here at the Office of Minority Health. We've been hearing that the vaccine was made too quickly. Some people wanted to get the full FDA approval first before they got it. Some people have said it might affect their fertility. And then there's also been some places where we've heard people say, well, I've already had COVID, so I don't need the vaccine, type of message. So those are a few things that I know that we've been hearing here at the Office of Minority Health.
Thank you. Anyone have any other things? Sharon?
Yeah, I'm sorry. Am I cutting in on somebody?
Nope.
No.
Okay, great. So I wanted to share, I think this might be a great time to share the survey that we did. So a few months ago, Health Visions, in conjunction with the Indiana Minority Health Coalition, did a survey targeting many of the underserved populations that we work with. So it was mostly targeting, and when I say targeting, these are the people that fill out the survey, Black, Burmese, and Hispanic residents in Allen County. And these are some of the reasons that they listed for not being vaccinated. So it was a relatively small survey, but if you can think about, random sample. So this was from May to August. We had about 138 surveys that were completed. And you can see some of the demographics there. I'm sorry that the writing is kind of small on the screen, but I can certainly share this. But 3 in 10 respondents had not begun the COVID-19 vaccination process. Half of them would not get their children vaccinated right away. They already said that. So we've got the vaccines that are opening up for kids, but people are hesitant to do that for their children. The top vaccine concerns among the unvaccinated was not having enough information and freedom of choice. Also, unvaccinated persons indicated that the COVID-19 vaccines contain live virus and the side effects outweigh the benefits. Okay, so those are some of the things that we've broken this down here. So for African Americans, a lot of things, like I said, they said they didn't have enough information. For Burmese and those who were Latino American, they listed some other reasons why they had not been vaccinated. Aside from not having enough information, they said that they need an interpreter. They had a lack of transportation. They could not take off work. The registration process was too complicated. So many of them also believe that, getting the vaccine infringed upon their freedom of choice and religious values in some ways. And as Demarcus was saying, down here, when we look at the Latino population, there was that belief that vaccines cause infertility. And also vaccines contain a tracking device. So some of these may have likely been undocumented residents. So there are a variety of reasons that people have been giving concerning why they're not being vaccinated. Like I said, we had assembled this task force of various agencies, churches, and leaders in the community since March. And we, like Dr. Sutter, I am sure, did not think we'd be still doing this at this stage of the game and where we are. But we do respect people's freedom of choice. But the reasons that people are not getting vaccinated often waver, sometimes among ethnic groups. And when you have African Americans who have a distrust of the medical industry because of the history that they've experienced with implicit bias, with the Tuskegee experiment, and all of those things, there is this distrust that is built up in the African American community. Now, when you go to Latino residents, they may fear this rumor that there is infertility or a tracking device, those who are unvaccinated. So there are these various reasons that kind of, when broken down, they can differ among, the groups of people that you're talking to. I also read an article, I'm gonna say this and then shut up, because I know I'm talking too long. But I also read an article recently about how the disparity in terms of ethnic groups is really decreasing when it comes to why people are not getting vaccinated, that more and more African Americans are getting vaccinated, and that there's a large percentage of white Americans who are not vaccinated. So I don't want to make it seem like only the underserved groups are not getting vaccinated, because there's a huge percentage of white Americans who are not being vaccinated as well. And for them, it may hinge on this freedom of choice issue as well. In general, I'm sure there are various reasons, but in general, may hinge on this freedom of choice issue and feeling like, they shouldn't be told what to do. And also some theories about what the vaccine can do. So it's across the board. I think as a community and as an organization, what our goal has been is to raise awareness of credible information. And for those who, when they come to this awareness, when they come to the point where they do want to be vaccinated, we want to be there to supply them with an interpreter, to supply them with transportation, those issues, those reasons that we can conquer.
Thank you, Sharon. It was a great overview of the different reasons why some people might not want to get this vaccine. Any of our other panelists have any other information or reasons that have been brought to their attention of the hesitancy of this vaccination?
So, yeah, Demarcus and Sharon touched on the major ones as far as vaccine skepticism and almost, not getting vaccinated almost as an act of like defiance. But among my experience, it's been in talking to Hispanic patients, it's very heavily influenced on their social circles. So because so-and-so got the vaccine and experienced this, I won't get the vaccine. Or because so-and-so already had COVID and did okay, I can hold off on getting the vaccine. So definitely social circles have a lot to do with influencing why people don't get the vaccine. So.
Actually, I'll just hop in real quick.
Yeah.
I can. So I think the other panelists have really summarized this nicely. And the simplest way I'd say this is there isn't just one reason why people don't get vaccinated. There are multiple groups with multiple reasons. The good news is I do think we're seeing in minority populations a movement towards getting vaccinated more. And that group is definitely stepping up, which is great because those are the populations most at risk for severe COVID-19. Having said that, it has been framed as a political argument in this country by some to say that freedom of choice is the key issue here. And I would just try and add that freedom of choice is an important thing for Americans, but it needs to be balanced with community responsibility and how do we act together as a community. And I don't know that side has had equal speaking time, frankly. So those are my thoughts. I think we are seeing, the data is very compelling, and I think people will continue to see that first of all, the number of people who are unvaccinated really leading the number of cases, and we have a number of things that show that, but even more starkly, the ones being admitted and the ones dying are overwhelmingly unvaccinated. And so that becomes, I think, harder and harder for people who are saying, it is a freedom of choice issue. I'm not saying that I'm going to force people to get vaccinated necessarily. However, boy, we still have a number of people in ventilators in hospitals in this county right now. We have people who are dying almost every day of COVID-19. And the vaccines are tremendously effective in decreasing that. So I think we're seeing movement towards that. I think we'll see increased movement. It took 4 years to get everybody vaccinated for polio. And I think everybody gets the idea that getting vaccinated for polio is a good thing because we don't like paralyzed kids, right? It took 4 years in this country. So it takes time. I understand that people have lots of concerns. It's very confusing. And there's so much misinformation, disinformation. It's hard to know how to make a good choice.
Thank you, Dr. Sutter. That kind of brings us up to our next question. When people are making that decision, they're often told to trust the science. Why should we trust the science?
Well, as a self-proclaimed science geek, I've got a bias starting off, right? So I guess the answer is, if you're not making a decision based on science, what are you basing it on? Are you basing it on what your neighbor says, basing it on what your mom says, your dad says, just your gut feeling? I don't think those are helpful for technical decisions like this. So I would just argue that in a modern society, science is incredibly important. It doesn't always give us the right answer because it changes over time, but scientists are doing the best they can to try and get to that truth with a capital T. We never get there, but we try and move incrementally closer to that. And so I think it's the best way to base a decision about something like this.
I know, so there's a question brought that's kind of based on trusting that science and also relates to the other question of the side effects of COVID-19 vaccines, but related to the virus itself, could there be a reason why people aren't getting vaccinated because there's a downplay of just how severe the virus is?
So yeah, I can take that one again too. I don't want to be the only one doing the talking here. So I'd love for somebody else to jump up too. Absolutely. So there's been a systematic issue to challenge the data on almost everything, to say the 700,000 COVID deaths aren't real, which they are. The arguments against them are strawman arguments. To say, really people aren't getting that sick, or even going so far as to say people are getting more sick with vaccines than they are with the infections themselves, which is just, anybody who's in the field, anybody who's actually seeing patients like this knows that's just crazy. I'm sorry, crazy is not an inclusive term. I want to try and be as respectful as I can, but I certainly have a level of frustration around this. But yes, absolutely. I think there's another interesting piece Malcolm Gladwell talks about in his book, David and Goliath, about what happened in the UK, in London during the Blitz in the 1940s. And the fact that because people, if they didn't directly experience a death, they tend to be emboldened actually. And so the British people, instead of being terrorized by bombings, actually got went about their normal lives because they weren't directly affected. They weren't in the building that was getting bombed each time. It's a complex psychological argument. It's fascinating, though. It's in that book, and there's a recent podcast that came out this week called Solvable, where they interviews Malcolm Gladwell. Really fascinating way of looking at that argument. So yes, the answer in my mind is yes.
Thank you. And I know for the next two questions do relate to the side effects of the COVID-19 vaccine. So some people are curious, what are some of the side effects and if there are any long-term effects? For instance, and as it was brought up as one of the reasons of future fertility in women. And since these are medical questions, Dr. Sutter, as well as Candy, a registered nurse, if you guys would share your knowledge or observation of the side effects.
So generally, before I vaccinate patients, I ask them if like they have any questions, and obviously one of them is what are the side effects. So I mean, generally it does cause some pain at the injection site. It can, the arm can be tender, and then in a few days you can feel like a general malaise, even some fevers. But in a sense, I let them know like, hey, that's your body building that immunity. But as far as like long-term effects, I let them know that, hey, this has been authorized for pregnant women to get. And then I was reading up on the CDC, and they did, and it was again a small study, that it doesn't show any effects as far as fertility goes in men either. So I mean, that's what we know for now. So
I can hop in too. Candy, absolutely correct, and really appreciate that. I mean, what I would say in summary are mild adverse effects are very common. So sore arm, sometimes fevers, just feeling bad. Typically that's for about 24 hours and happens about 24 hours after the vaccine. Those are very common. There are severe adverse effects, and they are very rare. So these are severe allergic reactions, somewhere between about 1 in 100,000 to 1 million. With the Johnson & Johnson, there's been some clotting in the brain that's been reported, extremely rare, probably 1 in 100,000 to 1 in 1 million. There's been myocarditis in young men with the mRNA vaccines. That's the Pfizer and the Moderna. That's probably about 1 in 10,000 to 1 in 100,000. To put that in terms of risk, lifetime risk of being struck by lightning is about 1 in 10,000. So your risk of myocarditis as a young male with the mRNA is about your lifetime risk of being struck by lightning. It's about 10 times that to be to have one of the other more adverse effects. And it's about 1 in 1 million, which is about your lifetime risk of dying from an asteroid strike. So these are extremely rare events. Doesn't mean that they don't happen. When you give hundreds of millions of shots, they're going to show up. What we know from other vaccines as far as long-term effects is all of the bad things that have happened with vaccines have shown up within 6 weeks of getting the vaccines. So we've had vaccines that have been pulled off the market. We've had vaccines that have just been disasters. The RSV vaccine, the dengue fever vaccine, all look very promising in studies. And then when we put them into the phase 3 studies, we found that there are big problems with it. We all knew about them quickly. So it's unlikely that this vaccine will be the one to have a long-term effect that doesn't show up in the first 6 weeks. So if you're in the first 10,000 doses given, sure, that's an issue. Once you get to hundreds of millions or billions of doses given, very, very low risk that that's going to happen. And the last thing I'd put on this topic is everything that's bad that happens with the vaccines, with the exception of allergic reactions, happens worse with the virus. So if you talk about clotting, 10 to 100 times more likely to have a clotting problem if you get COVID-19 than if you get the vaccine. If you look at myocarditis, much more likely with a COVID infection. There is no evidence for fertility problems with the vaccines. There was a theoretical thing. If that were to be the case, it would be worse with the virus. We know that there are potentially fertility problems with men with the virus, but not with the vaccine. Also with erectile dysfunction, which is a big issue for a lot of, that's something that guys pay attention to. Problem with the virus, not with the vaccine.
Thank you. So the next question, some of this topic, we already kind of hit on number one, but I think it is so important that I want to bring it up again and see if anyone wants to share some more information with us. And that is, what can you tell us about the vaccinations and the Black, Hispanic, and Burmese communities in Indiana? What disparities are we seeing among different cultural communities?
So as far as the Hispanic, Latino community goes, the two major barriers or disparities would be a language barrier and just the lack of overall education. And the reason I say that is I was talking to a patient and they made valid points. They said, we're promoting the vaccine. We tell people they should get it, they should get it, they should get it. But then their questions aren't being addressed. And this patient's particular question was, how come the vaccine was developed so fast? And so I kind of explained to them that, hey, there's a family of coronaviruses. So the coronavirus itself has been studied for decades at this point. So they used that research to kind of develop this vaccine that would help in this pandemic. So that was an interesting conversation I had with that individual. And then as far as the language barrier goes too, again, people, there's not a lot of organizations that do have bilingual speaking people. And then they might have difficulties with language lines and things like that. So those are the biggest disparities, I think, when it comes to the Hispanic community, at least. So
Thank you for sharing, Candy. Any other panelists who could share some insight on this particular topic?
I would say as far as like the raw data, some of the disparities have been a little bit hard to see because there's also a lack of reporting racial and ethnic data. I know nationally, I think it said 62% of racial and ethnic data was reported. So that means that you have a lot of people that aren't, where we aren't capturing that information to see the true scope of the disparities. But I know here in Indiana, if you take a look at the dashboard right now, for instance, you would see that African Americans make up 9% of the 12 and up population that are eligible right now, but 7%, basically 72% of the eligible population is vaccinated right now. Which is pretty, they're looking for around, trying to get to at least 70%. But with that population, that's still as far as amongst all the demographics, that's still the lowest. So as far as the data, it's really kind of hard to get a true scope because there's so many people that we aren't capturing that demographic data from.
Thank you, Demarcus. That brings up one of our next planned questions, in which can you explain, if anyone has any background of this, how or if comparable and equitable studies have been done for vaccines and their effects and effectiveness across all racial and ethnic demographics? And if
I know when just kind of looking at some information before I joined the panel, it did say that both Pfizer and Moderna, they did report that they didn't have as good of a turnout as far as representation from minority communities, especially the African American community, and a lot of different things can play a part in that. Maybe there was a lack of awareness of, being able to participate in those studies. Lack of, maybe transportation was an issue. Some of those social determinants that we see with a lot of the health disparities may have played a part in, or lack of trust. I've heard that mentioned on here too. Some of those things may have played a part in that, but that was something that I had recently saw.
Yeah, I would just add that it was a real challenge and struggle for the vaccine makers on this. They were intentional about this. They were trying to get, they designed their phase 3 studies to try and be as inclusive and reach a diverse group as possible, but they were not as good at recruiting and bringing in people of color as what they were looking for. I think the sex, the male versus female, was pretty good in the way they chose the phase 3. So they tried to mitigate that by making this global testing. So there was a lot of testing through South America, through Africa, to try and get a larger, more diverse group. That has its own set of challenges, right? I mean, that's not a perfect way to do that. But I think there was some intentionality to it, and in the end, it was imperfect.
Thank you. Any other panelists want to share any of their viewpoints or observation on this topic of disparities among racial and ethnic groups before we move on?
Well, I think that we've talked a bit about the disparities in terms of who is getting the vaccine. But of course, there are disparities in terms of the consequences of getting the virus. And that has been highlighted over the past year and actually brought to the forefront the health disparities that have been here long time. Diabetes and obesity and lack of nutrition and those social determinants of health that I think Demarcus mentioned before. But this pandemic has really brought to the forefront the need for us as a community and different organizations to come together and try to bring people closer together in terms of access to health. You know, no one should be without a vaccine and have the potential for death because they live in a community where they can't access the vaccine, where there's no transportation. But that's what we're seeing. We're seeing people who don't have access to healthy foods. Those disparities are pronounced among underserved groups, the African Americans, Latino, and Burmese communities. And so that's why we need organizations, we need government officials to really compensate for that, to take that into consideration when devising programs, when putting together these initiatives on, okay, how are we going to disseminate these vaccines, to think about the disproportionalities that exist among people of color and how we can compensate for that so that our community can be in a better place. So the issue of health equity is major in this discussion, and the disparities, the health disparities that already exist that make people of color at higher risk for death and getting this virus. This is a major discussion that we need to be having in a consistent manner.
I just want to add on to that. This is Sheila. We don't really talk a lot about our neighborhoods and our physical environment and our housing. You know, some housing is overcrowded. You might have 10 or 11 different household members in one household. Within that household, you might have 7 or 8 different jobs. Within that, they're touching so many different people and then bringing it right back into the household. And so I think a lot of times we forget occupation, living situations and environments. Thank you.
And Sheila, I'm sorry, I have to piggyback off of that because that idea, that issue of occupation. People are working in different kinds of jobs that, despite all the federal guidelines and all of that, aren't really taking COVID seriously. For instance, there's a young man who actually, that I know of, actually caught COVID, tested positive, okay? Took off of work because of this. And the employer told him not to be retested because the employer did not want this young man to test positive again and have to miss more work. So they wanted him to come back to work as soon as possible. As soon as he stopped coughing hard, you can come back to work, and we won't have to continue to pay you because of these federal guidelines that we're under. This type of thing is happening, folks. It is happening all over. And that's one of the reasons why it's so hard to get rid of this virus. These other determinants that are out there, the environment, people's work, their jobs. Not everybody can work from home on Zoom. Their bosses won't let them. They don't have that kind of job. And so those are the things that we also need to consider when trying to attack this virus.
Thank you, Sharon. It was mentioned too, the access to this vaccine. And it does appear that some of the steps to register and receive the vaccination requires the use of technology. Has that been a factor in people's ability to get vaccinated? And are there any initiatives within Indiana in our community to support someone that maybe not be very tech savvy or even have access to technology?
I'll just speak on it briefly. I'm at Pilgrim Baptist Church. And so we reached out to become a vaccination site. And so for 2 days, we brought in folks for our convention, and we asked those folks to go ahead and either get your booster, get your shot. So I think you have to meet people where they're at. And so a lot of times I think we've forgotten about the church and the role that the church played in the African-American community. And so I think a lot of times we should not be reaching out to you, you should be reaching out to the churches. So I think that's a gap that we all need to fill, and the doctor is on the call. So I think that's something where the state or the powers that be need to reach out to the churches. Thank you.
Yeah, I was just gonna say, I know the health department, we've been doing those pop-up vaccine and testing clinics around the state. And we also have, there's phone numbers that you can call to get access without having to necessarily do all of that work yourself. And also there's been a lot of community members or organizations or groups like what was just mentioned that have been requested. We do have a request system where people can go online and do that. That probably helps out a lot of community members that aren't tech savvy, that can't go through that process. So we're trying to make it as easy as possible for people to get access, no matter what their skill level is with that.
Thank you.
Yeah, I'll just say, in our discussions with this, and Sharon was a part of these too early on, this was a big consideration, understanding that resources are not distributed equally throughout the community, right? And people who are heavily resourced find it much easier to get things like vaccines than those who don't have a lot of resources. And so, ultimately we put a couple of things in place. One, we work closely with transportation, realizing that was a key thing. And had community partners to provide free rides to our vaccination sites or other vaccination sites. Uber for a while had stepped up and offered free Uber rides to anybody who wanted to get to a vaccination site. Tried to connect churches with the state who actually had the resources to do the mobile vaccination. And then Sharon was nice enough to connect me with the churches, and Ready to Come As You Are, did a live stream to try and get more information out there. And hear from the pastors themselves, who were very instrumental with that. And I see Ruth Snyder says that Uber still has it available on the app. I wasn't sure. I didn't want to promise that because it's been a little while since we talked about that. But again, recognizing there are a lot of barriers to this and trying to knock down barriers wherever we could.
Yeah, and I know earlier Sharon did a public service announcement with some of community leaders and pastors. And so things like that, I think the face of this virus is in all of our household. We all know someone that had COVID. We all know someone that died from COVID. And I think when it's in your face like that, then you're more apt to get vaccinated, knowing that, your aunt passed, your uncle passed, your cousin passed. And so those deaths are still happening on a daily basis, as the doctor stated. Thank you.
Thank
Sorry,
you.
one more quick thing, if I could. The other key piece that I forgot to mention is, yes, in order to register for vaccinations, typically that's a web-based thing where you have to use a computer or a mobile phone. But 211 kind of stepped up, and early on they were not staffed to do it. So the first couple of weeks with 211 was not pretty, as they just got completely overwhelmed. But we worked with them directly. The state kicked up some more resources. They brought in translators. Still imperfect, but a great way to help people who aren't very tech savvy be able to get access to these vaccinations.
Thank you. So I have a question that for Dr. Sutter, as well as possibly Candy, to share your insight as a nurse. So in your opinion, based off the people who are still refusing the widely tested and authorized COVID vaccine, but they're all willing to try and even promote some of the untested and unauthorized and potentially dangerous, if used incorrectly, treatments. Why is that? Can you share any insight or any advice or observations?
Okay, so as far as the ivermectin, and using that as treatment for COVID. So I actually had a real life situation where a patient did go and use that, and it was veterinary grade. They fortunately didn't pass away, but it was the accessibility that they had to that medication. And again, it was for vet use, not for human use. So, in talking with this individual, I was like, why put something dangerous in your body and not the vaccine, which has been studied extensively? And again, it was just the fact that they were able to get it, without hurdles. So, again, I think this is a little hard as to why people want to use these, non-traditional ways. But in the end, sometimes it's just accessibility. Maybe they feel that they can't afford to pay for their, medical costs. And so that's why they resort to such things. So, yeah.
I'll just throw in a couple of things here. I mean, you listed a couple different things on there, which is kind of the whole spectrum, right? So hydroxychloroquine has been studied now with randomized controlled trials. It does not improve outcomes, and there's a small move towards harm in it. So nobody should be using hydroxychloroquine. Azithromycin, which is the antibiotic Z-Pak, wouldn't expect it to work on a virus. Extensively studied, doesn't help, might hurt. Ivermectin, interestingly enough, has not, the jury's not completely out on that. There were some interesting early studies which looked positive. The problem is one of the ones that showed the most effect was actually falsified. And so when it shows up in the later meta-analyses, it corrupts the rest of that data. There are 3 large randomized controlled trials going on worldwide right now, and so we will have an answer to that, but that answer isn't out yet. As a result, it is not recommended. It is outside an experimental study. The monoclonal antibodies, however, are very good, and there's good data on those now. They reduce admissions, they reduce death. They have to be given in the first week, and the problem is people don't get really sick until the second week. Right, so if you wait until you're ready to go to the hospital, the monoclonal antibodies don't help you at all. So my advice is, if you're positive for COVID and you're in a high risk group, that is, if you're over 65, over 55 with cardiovascular disease, if you're carrying extra weight, these are kind of the main things. If you're diabetic, then I would recommend that you go ahead and get the monoclonals, even if you're vaccinated. Now, if you're in a low risk group, you don't necessarily need to do that. Separate thing though, those things work. As for the reason why people are choosing these over vaccinations, Frankly, I think it's the way people are getting their information. So people tend to believe who's close to them. And for a lot of us, that's social media, right? So if you hear it from 10 different places, some of whom you trust, and you hear it over and over again, you start to think, okay, that must be right. And so if somebody's saying, yeah, you should go use that ivermectin, that works great. But those vaccines, they're full of trackers, and they're going to, who knows what's going to happen? They're going to grow a third eye. You get one of them, people start listening to that. And that's the way we all take it. Even if we think we're unbiased, that's how we make a lot of our decisions, is what the people close to us are saying. It's the environment we live in. It's the water we swim in. That's how we do it. And unless people are really thinking through this, it's easy to follow whatever everybody else is doing. When your mom said, if everyone jumps off a cliff, you're going to jump off a cliff too? Most of us, the answer is yes. Everybody else in our friend group's jumping off, we're right there with them, right? Hoping we grow wings on the way down. So I would just urge people again to take a step back and to start thinking about, okay, what's the actual data, not just what I see on social media, what's the actual data around this? And that seems very clear and compelling to me.
Thank you. That misinformation really plays a huge factor in COVID-19 vaccinations and this pandemic. We had sent a panelist an article, and I will also put the link in the chat for everyone. But according to this article called Uncoupling Vaccination from Politics, a Call to Action, it stated that politicization of vaccines is the dominant driver keeping down the vaccination rates. The article also claims that misinformation is at the heart of some of the anti-vaccination and anti-masking rhetorics. So I want to ask, what are some topics of information related to vaccinations that, as experts in your field, that you would like to clear up? If you have any misinformation that you would like to share to clear up and voice your opinion.
So this is just how do I say it? Just some general and things I commonly see. But getting the COVID vaccine does not give you the COVID virus or the infection. It essentially either obviously reduces your risk of getting the virus, or it can decrease the severity of the infection if you do become sick. And then, and I jokingly tell patients this too, they say, oh, it's a tracking device. It's another way the government can control us, blah, blah, blah. And I was like, okay, well then, if you were worried about that, you would have gotten rid of your phone a long time ago. So, that's what I tell patients jokingly, but I mean, yeah, so getting the vaccine again doesn't infect you, but it reduces the severity, so.
Any other misinformation out there that we want to clear up or give an opinion on?
How much time do we have? Oh, wait, I've got 10 minutes yet, and I got to hop off. So. Now, I don't want to, I guess the short answer is anything you read on Facebook or Instagram that doesn't come from the CDC or the IDOH or a journal like the Lancet or the New England Journal of Medicine, then it's probably not true. I mean, it's become a verb, right, to get Facebooked, which is to believe something that's untrue based on a social media post. Some of those can seem very authoritative. And, science is difficult to interpret sometimes. I mean, and you will find scientists, you'll find doctors who say the opposite of what the other 99% do. But I would just put forward, if you look at doctors early on with the vaccination, 96% of practicing doctors got vaccinated right up front. That's the group that's probably the best educated and actually sees patients. That group overwhelmingly stepped up and got the vaccine. So again, CDC has taken a lot of hits, and some of them are deserved. Has CDC done everything right? Absolutely not. But I still think it's a credible source of information. There are a tremendous number of experts there who are looking at this from a number of different angles. I think they're very good. It's what I use for my recommendations. There's a lot of other stuff out there too. Sometimes it can be a little difficult to interpret. And so, my first thing is, does somebody have MD or PhD after their name if they're talking about something that's science? So, one of the jokes, one of the memes is, so here's the guy who failed study hall who's going to talk to us about microbiology. So just because they look good or they talk fast doesn't mean you should be listening to them necessarily. So do I have all the answers? No. And is everything I say right? Probably not. But I'm trying as best I can to learn. I'm trying to pay attention. And things change. There are some things that we think are true today, and we're going to get more studies down the road and find, that's not exactly right. But we can say whether there's high confidence, medium confidence, or low confidence. And a lot of the stuff we have high confidence in at this point. So.
Dr. Sutter, could you answer the question of if there are any recommendations for those who've had heart surgery?
As far as whether to get the vaccine or not?
I believe so. It was.
Yeah. Those people who have had heart surgery would be in a higher risk group. If they get the virus, they're much more likely to become ill with that, to be hospitalized, or to die with that. So, that is a group that even more than other groups should get the vaccine, in my mind. Now, again, is the vaccine 100% protection? It's not. What it does is it reduces your risk substantially. So it's like wearing a seatbelt. Just because you wear a seatbelt doesn't mean you're invulnerable in your car. But if you get in a wreck, you want to be wearing your seatbelt. You want to have whatever protection you can get. So, to me, vaccines like the seatbelt, monoclonal antibodies like the airbags, you want every little bit of help that you can get with this virus if you're at higher risk. Now, if you're 18 years old, perfectly healthy, you've been vaccinated, your risk is extremely, extremely low. You've done what you can to help reduce that. Doesn't mean you can't spread it though. So you still can't go out and just completely live life normally at this point yet. We're still seeing high levels of community spread, but your personal risk is very low.
Thank you.
May I just jump in? Doc, why we have you on the call? I mean, a lot of folks we know have passed from COVID, but then you always hear complications of COVID. Can you just give us 60 seconds of complications of COVID versus someone dying from COVID? Thank you.
Yeah, so great question. The way that people typically die with COVID-19 is direct lung damage. So that happens typically around day 7 after symptoms start. And basically the immune system directly attacks the lungs. It reduces your ability to oxygenate, which means you require more and more oxygen. There's a progression where you get put on a ventilator, and then sometimes you die after being on a ventilator, directly because your lungs aren't working, because your lungs get damaged directly from COVID. But COVID causes lots of other problems too. So it can also cause kidney failure. It can cause some heart inflammation. It can cause brain inflammation. All those things would be considered complications of COVID. And then once you get so sick that you've been on the ventilator for, say, 2 months, you now are subject to having other infections in your body, having other things too. So while it might, in that case, not be the COVID infection directly that killed you, it's because you got so sick from the COVID that you ended up dying. Does that make sense?
Yes.
Yeah, and then one of the criticisms about saying the 700,000 dead weren't, the other stuff was on their death certificate. The stuff that was on the death certificate was respiratory failure. Well, the respiratory failure was because you had COVID directly. That's what caused it. So that's not, you can't say, well, they didn't die of COVID, they had a respiratory failure. It's like, saying somebody got shot in the chest. Well, they didn't die because they got shot. They got shot because there was a big hole in their heart. Well, how'd that get there? So some of the stuff's just silly. But it's complicated, and I can't explain it in a 10-second soundbite most of the time. So thanks for asking that question.
Thank you.
If I can just say something, just kind of off of what Dr. Sutter was just saying, I think that, I'm of course not a medical expert. And so I can't debunk a lot of the theories and things that are out there medically, but what I can do is give testimonials and my own experience and encouragement and support for people who are thinking about it or people who haven't even thought about it. I had a friend and I just assumed that she was vaccinated, but she hadn't been. And she said, well, do I need to be? I've been sitting in the house, but we were out at a restaurant. So I'm like, yeah, you might want to think about that. And so then she started really thinking about it. And so our connection together and me sharing with her that information was what she needed to get vaccinated. But going back to what Dr. Sutter was saying, I had another friend who, or kind of friend, like a friend of a friend, and she is an anti-vaxxer. Her cousin died of COVID here in Allen County in her early 40s, you know, not too long ago, died. And so approached with, you know, facing this information, it was like, okay, don't you think you might want to get vaccinated now? And she said, well, she didn't die of COVID, she died from pneumonia. So obviously the pneumonia was brought on by COVID, but there are people out there who are so resistant. And then I think an element of pride comes in where they can't just say, hey, maybe I need to kind of get this now. But I think as you know, community leaders and just, you know, everyday folks in the community, we can focus on people who are around us and sharing with them our experiences and lovingly talking to them about the things that we know, pointing them to resources and, you know, information from the CDC. The American Red Cross also has some great handouts out there as well, our local Northeast American Red Cross, and getting them the information that they need to where they can make an informed decision.
Thank you, Sharon. Awesome. Regardless of someone's COVID-19 vaccination status, we're still in a pandemic. Our community and our country and our world is. So, in your professional and a personal even opinion, how can community members support each other during this pandemic?
I'll go ahead.
Yep.
I think we need to keep it in their face. I think we need to constantly talk about it. We need to constantly remind people that we're still in the middle of a pandemic. I mean, we're constantly saying it. Everywhere I go, I'm constantly saying it. Are you vaccinated? Asking the question and starting the conversation. No matter how it ends, I still ask the question. I try to be mindful of people that I'm around. I have an 87-year-old mother. And so I'm very cautious. And so starting the dialogue, asking the question, are you vaccinated? I think is a way that we as community leaders and community partners can definitely take this on, how you want to say it, block by block. So thank you.
I'll hop on real quick and then I have to hop off. I apologize. I've got a 1 o'clock. You know, I love this forum. And, you know, I love the concept of doing this with grace, which I don't always do because I get all fired up. But, you know, I think I've probably reached the people that I can reach in my position. You know, I think where the opportunity is in friends and friends of friends. And so what I'd ask everybody on this call to do, and Sharon, you modeled how you do that, you know, first educate yourself. Even if you're not a medical professional, educate yourself so you've got some basic answers, or you can point towards credible information to answer things like fertility or tracking or other things. The resources are out there. And then just have the conversation, Sheila, just like what you said. You know, ask the question, are you vaccinated? And if not, you know, are there ways to ask that question and actually listen to what they have to say? You know, so I'm guilty of that all the time, right? I'm waiting for people to pause so I can talk next. But when I can step back and just say, you know, I really want to understand what your concerns are and let them be heard, I think that's really helpful. Has the ability to kind of ripple this out there. I saw one other question. I'll just hop off. Sorry, because how long do the antibodies last after COVID-19 infection? You know, 90 days. You're safe for 90 days is current CDC guidance. Probably conservative. Probably lasts longer than that, but we don't know because those studies aren't done yet. The reason why you can't say I've had COVID, so I'm bulletproof from now on, we just don't have studies to know that. There is natural immunity afterwards. We're just not sure how good it is. But there's 2 studies out there, one from Kentucky, one from Israel, both looked at people who had previously had COVID-19 infections. Those groups did better when they got vaccinated afterwards too. So even if you've had it, you got some level of protection, but there's no reason not to get an added level of protection by getting vaccinated. So. Okay, thanks. I got to run. Thank you so much.
Thank you so much. Thank you. We really appreciate all of your feedback and expertise. Thank you.
Thank you.
Any other panelists like to also share just ideas for community members to support each other?
Can I just say, interrupt quickly, Ashley?
Yeah.
Dr. Sutter had to leave, but there's a question in the chat, one that specifically was asked for him. What I can do, if there are any questions that I can take back to Dr. Sutter and we can get a response, then I can email you directly, if that's what you would like. Thank you.
All right. I know there was something brought up that, for me really just was a good reminder of that as we're supporting each other in the community is remembering that not everyone has the same access to resources, whether that be, food, shelter, clothing, or medical care, like a vaccination. And also not everyone has the flexibility in their employment to possibly take time off to care for a family or themselves. And that includes appointments to get vaccinations and whatnot. So just having that knowledge and reminder to yourself that equal access and opportunities isn't always the case in the community. So any way that you can support your neighbor, your family, and your friends always goes a long way. All right. Well, we are so grateful to have you panelists come, and so grateful for all the participants and viewers joining us today. We do understand this is definitely a sensitive topic, but it's an important topic, and we are still in a pandemic. So regardless if you decide to get vaccinated or not, remember the important practices of social distancing, hand washing, and wearing your mask when required and needed to protect yourself and others in your community. All right. That being said, feel free to, if you want to stay on and you've had a question that wasn't quite asked yet, you can stay on, as well as put those in the chat or email Joanne, Carrie, or myself, and we can get that question to the appropriate panelists if needed.
Great. Well, thank you everybody for being here. Again, if you guys have any other questions, speak now or forever hold your peace. Or if it's a direct medical question that needs to be answered by a doctor of some sort, we will try to seek out the answers, whether it's from Dr. Sutter or somebody else in the field. Unless Candy's able to answer it, she may also be able to as well. Any other, cultural or political questions that were not addressed in the conversation. If we want to chat, openly chat about these things, I think we have opportunities to do that now as well. Otherwise, we can give you back about a half hour of your time. I don't know that anybody would complain about that. So, so we just really appreciate you guys coming and joining us today. We really appreciate the panelists for being here and for giving us your information and your feedback, and just a little bit of prospect into what is actually real out there, because sometimes we get tunnel vision and don't actually see what's out there. So we appreciate you guys giving us that information. Joanne, did you have anything to add?
I just wanted to see if any of our panelists had any departing words or thoughts before we close out for the afternoon.
Oh, I just want to say it was an awesome platform. I think this is something that is needed. I think you might want to do it a little bit more often. I know I was part of this panel last year, but maybe there's another department or someone else on the call. I think we need to just keep this in people's face. We need to make sure that people know about the resources, know the opportunities. And so, I just encourage you guys to continue to do the work. And thank you. Thank you. Thank you.
Thank you, Sheila. Candy, I saw you unmute. Did you have any words?
Oh, no, I was just going to say thank you for having me. It was nice meeting the rest of the panelists. And, I look forward to providing information in the future too.
Thank you, Candy.
Thank you,
Demarcus.
I would just say, like Sheila said, it's a long haul. right now, with the eligible population that, for vaccines, we're at about 57%. A few months ago, we were 40-something%. So little by little, every day, these little conversations that we have with our communities, and it's all making a difference, even if it's not going as fast as we all would like. So,
and I just agree with that. My only remarks would be it is this battle, one battle at a time, one person at a time. I think when we can communicate just openly and honestly and respectfully, so that it's not a political issue, but talk to people where we are. We may not know everything. It's not all happening in one fell swoop like, I thought it would. But as we continue to have these conversations in these group platforms, but also have the conversation with the people who are close to us, in our families, in our circles, in our businesses, not breaking any HR rules, of course. But as we continue to have these conversations, we build awareness in that manner, and we help people to make a good decision for their lives, a healthy decision for themselves, and ultimately that's a healthy decision for the community.
Thank you. With that, just a huge thank you to the panelists. We appreciate you being here and taking time from your day. A big thank you to our moderator, Ashley Henderson. We thank you for representing. If for those who do not know, guest, Casey brought her class. Hello, class. Thank you, a biology class. Thank you for joining us. We really appreciate that you all are here. And then, of course, Carrie, who does a lot of work behind the scenes. So thank you all for being here. If there's nothing more, you are free to go.